So we are in the middle of the greatest expansion of community health centres in the history of Ontario. We're doubling the number of sites where people will be able to access care. So we're very excited about that. And we've doubled funding, doubling the number of sites, and of course the number of people that will be served will be increased dramatically. We really do believe in the community health centre model, particularly for people who are who have complex health needs, who may be recent arrivals from other parts of the world, who are just not in the mainstream of society, but have very important healthcare needs. So we need to be there for them. We need to be there for people living in deep poverty. We need to be there for our urban Aboriginal community members. We need to be there for people so they get the best care possible as early as possible. So the whole prevention piece is vitally important, and CHCs do that so very well.
So one of the things that Adriana, just in her closing remarks, talked about was that it's important that community health centers and the association pay attention to government and depend on government to some extent, but also do it themselves. So in terms of what community health centers themselves have to do to make your job easier to advocate on their behalf, what would you say are the most important things in the next while that they have to do?
Well, I think community health centers are still a bit of a secret in Ontario. I don't think most people know what a community health center is. So we need to work to get out the stories about the extraordinary things that happen in our community health centers. I know in my own community the difference the community health center has made for newcomers, for example, for other vulnerable groups. We need to get those stories told.
So there's two kinds of stories though that I've been hearing at the conference. I'd be interested in your opinion on what's most valuable. There's the drama story, the sort of this happened to this person, and then there's the sort of numeric data story, right? To say this is evidence-based, and that's a different kind of story. One's more emotional, one's more, evidence-based, obviously. Is there a mixture that works well?
I think that we need the evidence. We need to do the research. We need to look at the data, the evidence that demonstrates, especially for a particular population, that the community health center model actually does save money to the system as a whole. So you need that data. That isn't often a compelling story. So sometimes you need individuals to demonstrate what those numbers are telling you. So I think you need to combine both the hard facts and the emotional story.
Now, I've been sort of covering this conference for a couple of years now, and I keep coming to the same question, which is, it's so clear to somebody outside like me looking at the conference to say there is a need, it's served by community health centers, they're doing good work and stuff, but it is still a bit of a hidden gem, right? And it doesn't seem to be getting its message across, and I'm just puzzled by that. Have you got
Well, I'm far more optimistic, I think. I mean, we're in the middle of doubling the capacity of community health centers. That's an enormous vote of confidence in community health centers. So I think there's a lot good that's going on, and I've been traveling throughout the province at the openings of community health centers or the addition of new programs in community health centers, and the local media is very interested in those stories because we love our healthcare in Canada and we love to see innovation.
Great, thank you very much.
Thank you.